technology, it's moving at just a breathtaking pace, isn't it?
It really is.
And nowhere is that more obvious, maybe more critical, than in healthcare.
Yeah.
It's fundamentally reshaping how we get care, how records are kept,
Yeah.
even how diagnoses happen.
Yeah.
So today, we're doing a deep dive into a really comprehensive, systematic review. It's called Efficacy and Pitfalls of Digital Technologies in Healthcare Services. A systematic review of 2 decades. Quite a title.
It is. Okay, so let's unpack this for you. Our mission here, really, is to distill the absolute most crucial insights from 20 years of research.
20 years, wow.
Yeah, focusing on how these digital advancements are truly transforming healthcare. And we're looking at both sides, the incredible benefits, sure, but also the significant and sometimes kind of surprising challenges they bring.
Right.
We want to cut through the noise, see what genuinely works, what keeps tripping us up, and what might be next.
Okay, and this review, it's pretty hefty. It systematically looked at, 55 articles?
55, yeah.
And it classifies all these developments into 4 main categories. So we'll kind of walk through those.
Sounds good.
Let's kick things off with the big picture then. General digital technologies.
Okay.
These made just a massive impact. Everything from maintaining patient records much more efficiently.
Which is huge in itself.
Huge. To aiding diagnostics, streamlining emergency management, and enabling real-time remote monitoring. But what's fascinating are the specific examples like digital apps improving mental health outcomes.
Right. Sometimes even showing results on par with traditional therapy for certain things. Accessibility is key there.
Exactly.
Yeah.
Or think about smart textiles like fabrics with tiny sensors woven in.
Yeah, like the baby band example, replacing the bulky hospital monitors.
It's really changing the feel of care delivery, isn't it?
It absolutely is. But it's crucial to understand these tools, they don't come without hurdles. The review flags high costs, both infrastructure and just adapting, and user complications. I mean, you can just picture maybe an older person trying to figure out a complex health app, right? It's a real barrier.
Yeah.
And that points to the need for really good practitioner training, too. And then, well, the elephant in the room, privacy and security. Always a concern with digital health records.
Always. Okay, so moving on. Here's where it gets really interesting, I think. Artificial intelligence, AI, and machine learning. What did the review find here? It's not just automation, is it?
No, exactly. It's revealing these subtle patterns and massive data sets that honestly humans just couldn't spot.
Right.
What's insightful is how AI is going beyond simple task automation. It's really making personalized therapy much more possible, cutting down on repetitive tasks for doctors and nurses.
Training them up.
Precisely. And even powering robotic surgery, which in some cases is proving more efficient than conventional methods. Their power in predicting risks, diagnosis, even helping with prescriptions, it's immense.
And the adoption rate is high.
Yeah, reports suggest something like 86% of healthcare companies are already using AI somehow. But this raises an important question.
Okay, the gotchas.
Yeah, the gotchas. What are the challenges? And they are substantial. You've got legal and ethical dilemmas, especially when AI suggests a course of action.
Who's responsible? Right.
Exactly. And physicians need to really understand and, crucially, trust these algorithms. That means doctors need new skills to collaborate effectively with these AI systems. It's a whole new way of working.
Makes sense. Okay, shifting gears again. Blockchain technology. This one always sounds promising for security.
It does. The promise is significant. It's this decentralized structure, right? Designed specifically to tackle those security and privacy worries with things like electronic health records, insurance. The goal is encrypted, secure data transfer, building more trust, maybe even giving patients more control over their own health info.
My God, there's always a but.
There usually is. The reality is blockchain in healthcare, it's still very much in its infancy. The review found minimal widespread use right now. And there are big technical challenges. Processing speed can be an issue. And the data duplication needed for security makes it potentially very resource heavy for large scale stuff.
Okay, so potential, but not quite there yet.
You're quite mainstream, yeah.
Got it. And the last category, the Internet of Things, or IoT.
Right. All those connected devices.
Exactly. Everything from your smartphone to wearables. They're creating this interconnected web of healthcare resources, enabling real-time patient monitoring, improving care for, say, the elderly through continuous oversight. We even saw it used in public health, like screening during pandemics.
Yeah, very practical applications there. But the major hurdle for IoT, and it's a big one, is, again, security and privacy.
Seems to be a recurring theme.
It really is. These connected medical devices, they're targets for cyber attacks, and managing just the sheer volume of sensitive patient data coming from all these different points, it's a monumental challenge.
Wow. Okay, so pulling it all together.
Yeah, to sum it up, this review really highlights a core tension, I think. Digital tech offers these truly revolutionary advancements. Better care, more efficiency, accessibility.
Driven by lots of different fields working together, computer science, medicine, engineering.
Absolutely, a real multidisciplinary effort. But these incredible benefits, they come hand in hand with these persistent, significant challenges, especially around data security, privacy, and the need for us humans to adapt and trust the systems.
Right. That human element is key. So, thinking about our listeners, what does this all mean for you? Consider just how deeply intertwined our health and our technology are becoming. It's only going to increase, right?
It's inevitable.
So what role might you play? Maybe in advocating for a future where the effectiveness, the efficacy of these technologies really does outweigh the pitfalls to help ensure we get a secure, equitable, and intelligent healthcare system for everyone. Something to think about.